Sleepless nights aren't just frustrating, they're stealing years from your life. Chronic insomnia can increase your risk of heart disease by 45%. But what if you could wake up feeling energized and ready to take on anything? Today, I'll show you how to unlock deep, restorative sleep and why it's crucial for your health and happiness. We'll explore how sleep impacts your health and longevity, share practical steps to overcome insomnia, and dive into the latest sleep research and success stories. Plus, I'll reveal common mistakes that might be keeping you from deep sleep. Whether you've struggled for years or just want to improve your rest, you're in the right place. Let's get started. Insomnia is one of the most common sleep problems affecting millions of people worldwide. It involves difficulties falling asleep, staying asleep, or waking up too early and being unable to get back to sleep. This doesn't just mean restless nights. It translates into major daytime issues like irritability, poor focus, and not performing at your best. Roughly 6 to 10% of adults in the US suffer from insomnia disorder, and globally, rates vary between 2.3% and 25.5%, depending on the definition used. To put that in perspective, that's 1 in 4 people worldwide struggling with some form of insomnia. Like I mentioned, there are different types of insomnia, and understanding them is key. Acute insomnia is usually short-term, triggered by stress or significant changes like losing a job or moving. Chronic insomnia, on the other hand, lasts at least 3 months by definition and can be harder to identify the exact cause. Insomnia can also vary by type of sleep issue. Some struggle to fall asleep, which is called sleep onset insomnia. Others wake up frequently during the night, sleep maintenance, and some wake up too early and can't fall back asleep, which is called early morning awakening. It's more common in women, older adults, and people with depression or anxiety. The COVID-19 pandemic exacerbated the problem, with over 50% of people reporting sleep difficulties during that time. If you're struggling with sleep maintenance, waking up multiple times a night, try focusing on reducing caffeine intake after lunchtime or practicing relaxation techniques before bed, such as deep breathing. This can help. So why is insomnia so important to address? The health impacts are serious. Chronic insomnia puts you at significantly higher risk for heart issues like coronary artery disease, heart attacks, and strokes. In fact, people with insomnia have that 45% higher chance of developing heart disease, according to meta-analyses. It also contributes to all-cause mortality. Essentially, insomnia makes you more likely to die from any cause. For instance, in one study, the Hordaland Health Study, individuals with insomnia had over 3 times the risk of dying compared to those without insomnia over a 13 to 15-year period, with the risk being even higher for men. So even though insomnia typically affects more women, the risk of death linked to insomnia was higher for men in this study. Research also shows that struggling to fall asleep or feeling unrested is linked to a higher risk of early death, particularly in older adults, with the study showing a 39% increase in mortality risk. Another quick tip is if you're having trouble falling asleep, try a consistent wind down routine. So dim the lights an hour before bed, turn off the screens, and engage in a calming activity like reading or meditation. Insomnia isn't just a physical health risk, it impacts mental health too, creating a vicious cycle. If you're feeling anxious, you might have trouble sleeping. If you have trouble sleeping, that leads to worse anxiety. People with insomnia are more than 3 times as likely to develop anxiety or depression. Beyond mental health, insomnia impacts our ability to think clearly and be productive during the day, reducing our quality of life, increasing the risk of conditions like obesity, high blood pressure, and type 2 diabetes. I recently had a patient, let's call her Sarah, and when she came to me, she was so exhausted and frustrated. She'd been struggling with sleep for years, lying awake for hours, waking up multiple times during the night, and starting each morning feeling completely drained. It affected her work, her relationships, and her entire well-being. And she was frustrated by cycling through multiple different drugs and supplements as well. So together we developed a plan that included cognitive behavioral therapy for her insomnia. This is called CBTI. And this created a better environment for her to sleep and used mindfulness to manage her stress. And incredibly, even though all of those medications didn't work for her, it just took her a couple of months to see real improvements. She was falling asleep faster, staying asleep longer, and waking up rested. Her energy levels increased and her productivity at work significantly improved. She could finally attend her daughter's soccer games without feeling exhausted at the end of the day. Most importantly, she felt like herself again. So stories like Sarah's remind me just how important addressing insomnia can be and how we can do it with a combination of interventions from lifestyle and behavior to medications and more advanced therapies. So if you're like Sarah and feeling drained every morning, you can start by improving your sleep environment. Keep your room dark, quiet, and cool. I'm going to talk about these details more, but small changes can really lead to big results. Understanding insomnia is the first step to reclaiming restful nights and energized days. But before we jump right into the solutions, let me ask you, why do we even need to sleep in the first place? What makes it so crucial to our health and longevity? Let's dive in. Sleep is much more than just a way to rest. It's a powerful tool for keeping our bodies and minds functioning at their best. Think of sleep as the ultimate reboot button for the brain and body. When you don't reboot your computer for weeks and weeks, it starts to malfunction or act a little bit more sluggishly. Same thing as humans. If we're not rebooting regularly, we're going to be sluggish. During sleep, our bodies work on memory consolidation, immune function, hormonal balance, and so much more. On a biological level, sleep plays an essential role in maintaining our brain health. It's during sleep that the brain consolidates memories, transforming the short-term memories that we learned that day into the long-term storage and making sense of that day's experiences. There's some theories that that's why we dream. So our dreams may just be random firings of our neurons, but that dreaming and those random firings create an experience that feels like a really interesting dream in the process. So this process of consolidating memory is like saving important files and deleting unnecessary ones, keeping your mental hard drive organized. Sleep also helps clear out toxins that accumulate in the brain during the day, much like taking out the trash to prevent buildup. Sleep also plays a vital role in our immune system. When we sleep, the body boosts the production and function of immune cells. This is our first line of defense against infections. Imagine your immune cells as soldiers. They need sleep at night to stay strong and fight effectively. Studies have shown that people who don't get enough sleep are much more likely to get a cold after being exposed to a virus. Sleep also helps balance inflammation, reducing harmful inflammatory markers and promoting the production of anti-inflammatory molecules. This balance is crucial for protecting against chronic diseases like diabetes, heart disease, and neurodegenerative disorders. So if you want to boost your immunity, just try getting 7 to 8 hours of quality sleep per night. So think of it as recharging your internal defense system. Sleep is also crucial for maintaining hormonal balance. During deep sleep, our bodies release growth hormone, which helps with tissue repair and growth. At the same time, sleep reduces cortisol, a stress hormone, allowing the body to recover and reset. Lack of sleep affects hunger-related hormones as well, like leptin and ghrelin, which control your appetite. So if you've ever found yourself craving junk food after a poor night's sleep, that's because your body is increasing ghrelin, the hunger hormone, while reducing leptin, the hormone that tells you you're full. It's no wonder people who don't get enough sleep often struggle with weight gain. In fact, I have so many patients, I'll just use one, Mark, as an example, who was struggling with managing his weight for years despite eating really well and exercising. But then it came out that he was such a busy executive for his entire life that even in retirement, he was struggling to sleep well. So we had to intervene quite drastically to improve his sleep. But after that, his cravings decreased dramatically, and he found it so much easier to cut down on the late night snacking that was contributing to his weight gain. So we realized together that the sleep was that missing puzzle piece to achieving Mark's wellness goals. Getting quality sleep is a major factor in longevity. So studies have shown that improving sleep quality can directly impact how long and how well we live. During sleep, our bodies repair DNA damage that occurs during the day. Think of this as fixing wear and tear so that our cells can keep working properly. The protective effects of sleep can help extend our health span. That's the number of years we live in good health, free from chronic disease. As a quick tip, aim for quality sleep tonight by dimming the lights an hour before bed. This small change can support your hormonal balance and help promote restorative sleep. Sleep's impact goes beyond just physical health. It's also deeply connected to our happiness and emotional stability, as I previously alluded to. During REM sleep, our brain processes and integrates emotional experiences, reducing the intensity of negative emotions and helping us adapt to challenges. Imagine REM sleep as a kind of emotional talk therapist. It helps you make sense of emotional experiences and reduces stress. This actually comes out a lot in our PTSD patients. So in PTSD, unfortunately, people have nightmares. And there's a theory that they have nightmares because They're unable to discharge the emotional shock, the terror, and the anxiety associated with a particular memory. So the brain keeps trying to make sense of it, keeps trying to discharge that emotional energy, but is unable to, which is why the nightmares recur and the person still experiences recurrent PTSD symptoms. Adequate sleep maintains strong connections between brain regions responsible for regulating emotions, like the prefrontal cortex and amygdala. This connectivity allows us to respond more calmly to stressors, leading to better emotional regulation and overall happiness. Let's take a pause. Have you ever noticed that a good night's sleep makes you feel less reactive and better able to handle stress? Think about the last time you woke up well rested. Did it change how you approached challenges? In short, sleep is a foundational pillar of health that supports everything from memory and immune function to emotional balance and long-term well-being. Improving sleep isn't just about feeling less tired. It's about unlocking a longer, healthier, and more fulfilled life. So a quick recap: memory and brain health. Sleep helps consolidate our memories and clear out brain toxins. Sleep also boosts our immune cell production and balances inflammation. Sleep supports our growth hormone production and regulates our appetite. And REM sleep reduces negative emotions and improves our resilience to stress. But why is it that some people can't seem to sleep, no matter what they do? Next, we're going to explore the common causes and genetic factors of insomnia and what might be preventing you from getting the rest you need. Insomnia is a tangled web of physical, psychological, environmental, and genetic influences. To truly tackle insomnia, we have to understand what's behind it. First off, stress is a major sleep thief. Whether it's work deadlines, money worries, or personal drama, stress can make your brain go into overdrive right when you need it to slow down. Ironic. Stress-related sleep reactivity is how your sleep responds when life gets tough. This plays a huge role in insomnia. If you're somebody who's highly reactive to stress, I know I am, you're much more likely to struggle with insomnia after a stressful event. As a quick tip, if stress is keeping you up, try a relaxation exercise before bed, like deep breathing or progressive muscle relaxation, to help calm your mind, take it away from the stressful event, and bring your body down into deep sleep. Anxiety and depression are also huge sleep disruptors. If you think about those nights when your mind just won't shut off, every worry just seems louder when you lie in bed, that's anxiety feeding your insomnia. And if you're like me, you may have noticed that your worries and your concerns are way louder when you're lying in bed unable to sleep. You might get up the next morning and you're like, oh my gosh, it's not a big deal that I forgot to write this thing in that email. But it seems like such a big deal when you're lying awake in bed. That's normal, unfortunately. Depression isn't much different. It also creates this vicious cycle where poor sleep worsens your mood, making it harder to get quality sleep. Some people need to sleep longer when they're depressed, but that sleep is not necessarily restful. Chronic stress can lead to those intrusive thoughts that keep looping in your mind and causes a sense of hyperarousal, like your brain is stuck in alert mode and just can't power down. Tackling these mental health aspects is often key to breaking the cycle of insomnia. If you're somebody who's dealing with a lot of stress, anxiety, or depression, I urge you to tackle that first. Without dealing with that, it's really, really hard to solve the sleep issue. Then we have environmental factors. So blue light exposure from phones, tablets, and TVs is a big one that we all hear about. If you're scrolling through Instagram or catching up on emails in bed, that blue light tells your brain it's still daytime, messing with your natural sleep cycles. And it's not just screens. Environmental noise, bedroom lighting, and even a cramped living space actually can interfere with your sleep. And also, an inconsistent sleep schedule, like staying up late on the weekends or dealing with night shifts, can disrupt your body clock, making it harder to fall asleep when you need to. So try reducing your blue light exposure by turning off screens at least an hour before bedtime. I know that's so hard. If you're like me, you're stuck on your screens till very late at night, and I know that affects my sleep. Turn on your flux or your night mode at the very least, or get blue light blocking glasses to help with maintaining your circadian rhythm. Replace it instead with perhaps a boring audiobook. I love listening to audiobooks near bedtime, actually all the time. Or you can listen to relaxing music. Now let's talk caffeine. This is everyone's favorite pick-me-up, but it does linger in your system for a lot longer than you think. Even when you're not feeling jittery or awake anymore, it actually can prevent your brain from winding down for many hours. So if you're struggling with sleep, consider cutting off your caffeine earlier than you have. So some people, they say they stop caffeine at 5 p.m. If you're still having trouble sleep, move that to 3 p.m. or move that to noon. For myself, when I'm dealing with insomnia, I just stop drinking caffeine entirely. One actionable tip is just record the last cup of coffee for you. Oftentimes, this is a lot easier than doing a lot of the other things we talk about. So just measure the time of your last coffee and see how you sleep the next night. Genetics also play a big part in insomnia. So certain genes can make you more likely to struggle with sleep. Researchers have identified several factors that influence how our brains manage sleep and wakefulness. For example, there's the MEIS1 gene, which is linked to both insomnia and restless leg syndrome. If you notice that you have one or both of these conditions, you may have a certain mutation of that gene. Genetic studies also show that some people are more vulnerable to stress-induced problems due to their DNA, so making them more likely to develop insomnia during stressful times. This is absolutely true in my family. Every single person I can think of in my maternal branch of my family deals with insomnia and runs a little bit more on the anxious, stressed side. And this, unfortunately, is very genetic in nature. You can just tell from looking at who it affects. It's not necessarily who lives together, because many of us didn't even grow up or spend much time together. It's just a consistent genetic trend. You might be able to find certain familial trends like that in your own family too. Quick recap. Stress definitely is a big factor in keeping your brain in overdrive, preventing relaxation. Anxiety and depression create a cycle that makes sleep more challenging, so fix that first. And environmental factors like blue light and inconsistent schedules disrupt our natural sleep cues. Finally, caffeine stays in your system for much longer than most people realize, and genetics are a big factor that you may want to look into. Unfortunately, not much we can do about genetics, but at least it can validate your concerns. The good news is, by understanding what's behind your sleepless nights, you can take steps to regain control. So let's explore the essential habits and strategies that can help you build the foundation for deeper, more quality sleep. So diving into the practical science-backed habits that can help you sleep better starting tonight, I like to talk about the sleep optimization toolkit, or sleep first aid kit. So each of the strategies I'm going to talk about is a tool that you can use to take back control of your sleep and well-being. First up, let's talk sleep hygiene. Some of you may be familiar, but for the rest of you, this is super important. Sleep hygiene is all about setting up the right habits to tell your brain and body it's time to wind down and rest. Like dental hygiene, brushing your teeth, this is absolutely important for you to practice every single day. Start by creating a consistent wind down routine. This could be 30 to 60 minutes before bedtime. Spend doing things that relax you. So whether it's reading or doing some light stretches or practicing a bit of deep breathing, the goal here is to signal to your body that bedtime is near. And of course, avoid those blue lights, those screens in the hour at least before your bedtime. That can really interfere with your melatonin production. And like I mentioned before, regular sleep schedules absolutely important, even on the weekends. I know it's really tempting to sleep in on the weekends, but the consistency is so valuable for keeping your circadian rhythm in sync. And don't forget about the physical environment where you sleep. So your bedroom should be cool, dark, and quiet. Ideally, you'll want to keep the temperature somewhere between 20 to 25 degrees Celsius or 68 to 77 degrees Fahrenheit. This temperature range has been shown in studies to promote the most restful sleep. It's a little bit warmer than what I hear getting thrown around. A lot of people say 65 degrees, but actually it's a little bit warmer than that. And everybody's got their own preferences. I know for me, 77 degrees is going to be on the hotter side. And it also depends on how reactive your HVAC system is to the thermostat. So play around with it, but you're probably going to land in the high 60s or low 70s degrees Fahrenheit. If you've got any light sneaking into your room, blackout curtains can be a game changer. Because I have blinds, I even have those blind sides that I glued to my windowsill to block the cracks of light that come in from outside. I unfortunately live in a high rise in Manhattan, and for whatever reason, the building across the way always has their lights on. It's very irritating and also terrible for the environment. But that's what you have to do if you're dealing with external factors that you cannot control. If noise is an issue, earplugs or a white noise machine can help create a peaceful atmosphere. I'm so easily woken by noise that I do both. I do earplugs and I have this air purifier, which is essentially a very loud white noise machine. Take a look at your sleep environment today. So sometimes it's even just a simple tweak, like lowering the temperature slightly or using blackout curtains that make a huge difference. Now let's talk circadian rhythm. Circadian rhythm is your internal clock, and keeping it running smoothly is crucial for good sleep. One of the best ways to support your circadian rhythm is morning light exposure. So spend 15 to 30 minutes outside in natural sunlight shortly after waking up. This helps reset your internal clock and tells your body that it's time to be awake, making it easier to produce melatonin later at night. This is so incredibly hard for those of you who are with me in the Northeast or another place that is very cold, because I really don't want to go outside in the morning. But that extra chill can also wake you up. And it doesn't matter, just wear your pajamas, go outside, just walk around the block. And if you have a dog, this is a great way to wake up in the morning and reset your circadian rhythm. Another circadian supported habit is time restricted eating. So try to eat within an 8 to 12 hour window each day and finish your last meal a few hours before bed. There are a lot of fanatics out there who argue about, oh, you've got to eat 4 hours or more before bed, or even 6 hours. But the reality is that every person is different. And think about it. All of our digestive systems work a little bit differently. If you're somebody whose GI system works a little bit more slowly, and you know this because you might run more towards constipation than others, then you're probably going to want to eat bit earlier before your bedtime. But if you're somebody who's just churning through all your food really quickly, you could probably eat up to an hour before bedtime. Highly, highly variable. Studies show that aligning your eating patterns with your body's natural rhythm can actually make a huge difference in your sleep quality. As a quick reflection, think about whether you go outside at all in the morning, and tomorrow just spend 15 minutes in the sunlight right after you wake up. See if it makes any difference. Or set your dinner time a little bit earlier so that you're done at least 1 to 2 hours before bedtime. If you're dealing with chronic insomnia, then cognitive behavioral therapy for insomnia, or CBTI, is the gold standard, and it's really effective. It's recommended by the American College of Physicians as the go-to for insomnia for good reason. It targets both the behaviors and the thoughts that are keeping you up at night. So CBTI includes several components, which I'll go through. Sleep restriction therapy is number one. Sleep restriction sounds really counterintuitive, and it does involve restricting your time in bed. The idea behind this is to limit your time in bed so that you don't associate bed with trouble sleeping. As your sleep efficiency improves, so as you're getting more and more tired and you're spending a greater percentage of time in bed asleep, you will gradually be able to extend the amount of time in bed. This is a little tricky at first, and you might have to spend a couple of days feeling kind of tired. But for those of you who are dealing with really severe insomnia, this is actually a cool trick. Stimulus control is the next part of CBTI. So this is about creating the right association between your bed and sleep. You want your bed to be a cue for sleep, not for work or watching TV. So don't bring your laptop into bed. I don't even keep my phone in my room when I'm going to bed. I put it all the way outside, and I'll use an Apple Watch to wake me up if I need an alarm. When we watch TV shows, you always see people like reading in bed, doing a bunch of stuff in bed, even watching TV in bed. And that shocks me all the time. I'm like, how can people sleep well if you've got a TV in the room? I don't even read in bed, and reading is pretty calm, I know. I do it outside of the bedroom, and then I go brush my teeth and I'm right into bed. Cognitive therapy itself can also be helpful and is part of CBTI, obviously. So this is talk therapy and helps you challenge and change unhelpful thoughts about sleep. For example, if you constantly worry that you'll never get enough sleep, cognitive restructuring can help you reframe those thoughts. You could work on this with a therapist, or there's even apps where you can do this on your own. It's highly learnable. Then we have techniques like progressive muscle relaxation or guided imagery, relaxation techniques, which are great for calming the body and mind before bed. And then finally, it includes the sleep hygiene education that I already mentioned. So avoiding caffeine in the afternoon and sticking to a regular sleep schedule. Like I mentioned before, I've often used CBTI alone for my patients dealing with insomnia. And this is because a lot of times you don't want to end up stuck on a supplement or medication regimen that you become dependent on. Oftentimes, I work with patients through these behavioral tactics because it's longer lasting and it's generally good for you overall. It's calming you down, which is important in addition to the sleep benefits. So if you're interested, you can access CBTI through a trained therapist or even through apps like Sleepio or CBTI Coach. Many healthcare providers can also get you started on a personalized CBTI plan. Now let's talk about some innovative science-backed interventions and products that can really improve your sleep quality. Weighted blankets are one of my favorite recommendations. Why do weighted blankets work? I remember when they first came out, I was like, wow, this is the most bizarre thing, but it kind of makes sense when you think about how good it feels to be held. Weighted blankets work through something called deep pressure touch stimulation, DPTS, which helps calm the nervous system. Research shows that using a weighted blanket can increase melatonin and serotonin levels while reducing your cortisol levels. And that all helps you fall asleep faster and sleep sleep more deeply, especially if stress is keeping you up. Another powerful tool is breathing exercises. Practicing slow, deep breathing, around 6 breaths per minute, can help activate the body's relaxation response. Spending just 10 to 20 minutes before bed doing paced breathing or a guided yoga nidra meditation can help you wind down and prepare for sleep. Now let's dive into the diet, exercise, and lifestyle habits that really impact our sleep quality. Interestingly, specific diets do impact your sleep. The Mediterranean diet, which has been proven to help so many other aspects of our health and longevity, is indeed fantastic for your sleep. The Mediterranean diet includes lots of fruits, vegetables, whole grains, and healthy fats. These are so good for sleeping. They help stabilize your blood sugar with all the complex carbs and the fiber involved, and they also reduce inflammation. Avoiding heavy, high sugar meals right before bed additionally can add to the benefits of a Mediterranean diet. Alcohol is another tricky one. Alcohol is part of traditional Mediterranean diets, but we know for a fact that it's bad for your sleep. Alcohol can make you feel sleepy initially, but it actually disrupts your sleep cycle, particularly during REM sleep, leading to more fragmented rest. Reducing alcohol, especially before bed, can make a significant difference in sleep quality. Test this out for yourself. For people who have sleep monitors, such as a watch, or are perhaps doing sleep studies regularly, you can tell how early you have to have alcohol before it stops making an impact on your sleep. Everybody's going to be different. It's similar to caffeine. So if you have alcohol at noontime, very unlikely that's going to be impacting your sleep. But then you're having alcohol at noontime, which might be a kind of an unusual behavior, something to look at. Regular exercise is also one of the most natural sleep aids. So aim for moderate aerobic exercise like walking, swimming, or cycling during the day. This helps reduce the time it takes to fall asleep and improves overall sleep quality. And in the evenings, gentle practices like yoga or Tai Chi can help you relax both mentally and physically. Remember, sleep optimization is not one size fits all. A lot of these tools are part of your sleep optimization toolkit. So you want to start small. Try one thing tonight, like establishing a consistent bedtime this week, or add some morning sunlight exposure. The key here is consistency. Your health really is what you do every day. Next, we're going to explore supplements and medical interventions that can support your journey to better sleep. All right, now let's dive into the world of sleep supplements, the ones that could transform your nights from restless to restorative. There's a lot of noise out there about what works and what doesn't. So I'm here to cut through the myths and give you the real science-backed info. I'm going to walk through the best supplements for sleep onset and sleep maintenance and how they work and how you can experiment with them to find out what works for you. First, let's talk about sleep onset supplements. So these are supplements that are going to help you fall asleep faster. Let's start with melatonin. Melatonin is incredibly popular and we use it even in children. So what is melatonin? Melatonin is a naturally occurring hormone in our bodies that helps regulate our sleep-wake cycle. And it's especially helpful if your sleep issues are linked to a disrupted circadian rhythm, like if you're dealing with jet lag or work night shifts. For older adults who have trouble asleep, a 2 milligram dose of prolonged release melatonin is often recommended. So the prolonged release part is really important because this helps keep melatonin levels steady throughout the night. Some people don't need that. Some people just need a little touch in the early part of the night. And 2 milligrams is already a pretty high dose, even though this is recommended, it's been studied. I start people way lower when possible. I get those baby gummies that are, 1 milligram, and I'll cut them in half or even fourths. The truth is our bodies can respond to just a few hundred micrograms of melatonin. That's how much our bodies are using to fall asleep each night. So the supplements are way higher doses than what your body normally produces. Valerian root is another great option for sleep onset. It works by boosting GABA levels in the brain, essentially turning down the noise of an overactive mind. The typical dose is 300 to 600 milligrams, taken 30 minutes to 2 hours before bedtime. Some people find it also works well when you combine them with hops, which can also enhance its calming effect. Next up is L-theanine. This is an amino acid found in tea, particularly green tea, and it's known for its calming properties without causing drowsiness. A 200 milligram dose taken in the evening can help ease your mind into a more relaxed state, making it easier to fall asleep. L-theanine works by boosting alpha brain waves, which are associated with a relaxed state, while also enhancing GABA, serotonin, and dopamine. So if your mind tends to race at nighttime, consider L-theanine because it's a great way to relax without feeling sedated. Now let's talk about supplements that can work for helping you fall asleep, but can also help with sleep maintenance or staying asleep. So I mentioned GABA before. You can actually take GABA, but GABA in its natural form is a neurotransmitter that helps calm excessive brain activity, which can be especially useful for staying asleep. A 111.1 milligram dose, very specific, of GABA before bed has been shown in studies to reduce the time it takes to fall asleep and help maintain sleep throughout the night. Chamomile is also a gentle but effective herb that's been used for centuries. Drinking a chamomile tea or taking 1 to 2 grams of dried chamomile flower about 30 minutes before bedtime can help ease the anxiety and promote restful sleep throughout the night. Then we've got L-tryptophan and 5-HTP. These are serotonin precursors. So L-tryptophan is an amino acid that's converted into serotonin and eventually melatonin. Taking 1 to 2 grams of L-tryptophan on an empty stomach and typically before bed can help improve your sleep. I know that's hard, empty stomach and before bed. A lot of us have dinner in our stomachs before bed. So you could take it earlier. The reality is it takes a lot of time for it to get digested, so it doesn't have to be right before bed at all. This can particularly help if you are dealing with low serotonin symptoms like anxiety as well. 5-HTP, which is next step from the tryptophan, is also a great option. Taking 100 milligrams to start or up to 300 milligrams before bed can work faster and be very effective for those whose insomnia is linked to that low serotonin. So also if you have low mood or anxiety. Then we're going to talk about supplements that help with general relaxation and stress reduction. Magnesium is the essential element for over 300 biochemical reactions in the body, including relaxation and sleep regulation. Magnesium glycinate is a popular choice. It's well absorbed and less likely to cause digestive issues. Plus, the glycine is proposed to also support our sleep. A dose of 200 to 400 milligrams in the evening can help promote relaxation and improve sleep quality, especially for older adults. So if you're struggling with stress and sleep, magnesium glycinate is a great place to start. It's well tolerated and it also relaxes your muscles. Ashwagandha is an adaptogen that helps the body cope with stress and has been shown to improve sleep quality as well. So a 300 milligram dose of ashwagandha extract taken twice daily can help reduce sleep-related insomnia. If you're like me, that's way more than I was previously taking. So it's interesting to find out the doses and protocols that were studied. This is extra helpful if your insomnia is caused by chronic stress. Passion flower is another great herb for anxiety-induced insomnia. Taking 500 milligrams before bedtime can help you relax and maintain sleep throughout the night. The way it works is passion flower increases GABA levels, much like valerian. When it comes to supplements, personalization is super key. So what works for you might not work for somebody else, and sometimes you need to do a combo approach. For example, taking melatonin for falling asleep and making sure that you have adequate levels of magnesium and L-theanine to help maintain that restful sleep throughout the night. If you're not sure where to start, pick one supplement, for example, melatonin for sleep onset or magnesium for sleep maintenance. Give it at least a week to see how it affects your sleep, and always start with the lowest recommended dose. Oftentimes people develop some sort of tolerance and they have to go up, but the key is not to try to go up too quickly. And you can even take holidays, even every other day, or taking a third day off, or on the weekends taking it off. I find that to be really helpful to make sure that you don't become too dependent on any one supplement. And before taking any new supplements, of course, consult your doctor, especially if you're on other medications or have existing health conditions. Supplements can interact with all kinds of things, including medications. And so what works for one person definitely might not be suitable for somebody else. Now let's dive into medications. So prescription pharmacologics for insomnia. Sometimes lifestyle changes and supplements just aren't enough. So that's where we use medications. Medications are really powerful, but they also have risks and nuances that you should be careful about. So in this section, I'm going to be guiding you through the different types of sleep medications, how they work, and how you might understand what might be the best choice for you. But since these are prescription, you will be talking to your doctor anyways. But this gives you a bit of a primer since we all know we never have enough time with our doctors. First up are the benzodiazepine receptor agonists, often called Z drugs. So these include zolpidem, Ambien, azopiclone, Lunesta, and Zolaplan, which is Sonata. These medications work by enhancing the effects of GABA, a neurotransmitter that helps calm your nervous system. So basically, they slow everything down, making it easier to fall asleep. Notably, though, because they're related to the benzodiazepine pathway, we don't prefer them in medicine. They're not great for your brain health long term. Plus, you can have side effects like walking without knowing what you're doing. People have been tweeting in their sleep, eating in their sleep. So it's quite a dangerous class of drugs, but it works incredibly well for people who are just suffering and just need something short term. You'll get these doses from your doctor, but typical doses are zolpidem, 5 to 10 milligrams, azopiclone, which is 1 to 3 milligrams, and zaleplone, which is 5 to 10 milligrams. The Z drugs are so effective in helping people fall asleep and sometimes with staying asleep too. But in addition to all of the ambient related actions in your sleep, you have downsides like daytime drowsiness, cognitive issues, and the risk of dependence if you take them long term. These medications can cause amnesia and coordination problems as well, especially if you're using it regularly. Definitely, people develop tolerance to these over time. So Z drugs are useful for short-term help with falling asleep, but they are habit-forming and come with a lot of side effects, especially if used regularly. I don't love prescribing these. I almost never do. If you're looking to avoid traditional sedatives, then working on that melatonin receptor pathway might be the best bet. So Ramelteon works by mimicking your body's natural melatonin, but at a different part of the pathway than melatonin supplements. So it binds to receptors in our brain that regulate your sleep-wake cycle. This is more about getting your internal clock back on track rather than knocking you out. So it feels a bit more gentle. The usual dose is 8 milligrams taken about 30 minutes before bed. It doesn't carry the risk of dependence like some other sleep medications, which is a huge plus. Again, like with melatonin, if your insomnia is related to circadian rhythm issues like shift work or jet lag, then Ramelteon is a safe and effective option. Next, we have a very modern and popular option. These are the dual orexin receptor antagonists, or DORAs for short. They're really exciting because they work so differently from older sleep meds. DORAs like suvorexant, which is Belsomra, lemborexant, Dayvigo, and daridorexant, or QUVIVIQ, they block the brain's orexin receptors. Orexin is a neuropeptide that promotes wakefulness. And so by blocking it, DORAs essentially turn off the brain's stay awake signals. As you can imagine, this is way more gentle, but highly effective. So the typical doses you might get are for suvorexant 10 to 20 milligrams, lemborexant is 5 to 10 milligrams, and daridorexant is 25 to 50 milligrams. And they're great because they have a lower risk of dependence compared to the older meds, and they tend to have fewer next day side effects. They're especially helpful for people who struggle both with falling asleep and staying asleep. Plus, you don't get a groggy feeling the next day, which makes them a fantastic option for most people. There's a big problem, which is that they're very new, so they're quite expensive, and oftentimes insurance will not cover them. Just a really tricky thing that we have to work through while they're still on patent. Now, let's talk about some more atypical medications, but medications that are pretty commonly used. Low-dose doxepin is an antidepressant, actually, but when we use it at a very low dose, it works like an antihistamine, almost like Benadryl does. So at 3 to 5 milligrams, it blocks the H1 receptors, much like Benadryl does, and reduces wakefulness and helps us stay asleep throughout the night. It's really good for people who fall asleep easily but can't seem to stay asleep. Since the dose is really low, it doesn't have the same broad effects on the nervous system that higher doses do, so fewer side effects. The most common ones, however, are mild sedation and occasionally dry mouth. And unfortunately, the low dose, ironically, is more expensive than the higher dose because the higher dose was what we used to use way long ago for depression. We don't really use doxepin for depression anymore, or I've never heard of anyone doing it in recent memory. But this newer version was created and patented. It's more expensive, and oftentimes you won't be able to get it covered by insurance. It's a little bit annoying. Sometimes you can take the higher dose and cut it up into quarters even to get to that low dose for sleep. Now let's talk about some other medications that are used off-label for insomnia. So off-label means that these medications aren't officially on label for sleep. So they're not FDA approved for sleep, but they're FDA approved for something else, and they're generally considered safe. So we use them for insomnia for people who have struggled with behavioral interventions or with other meds. So first, we've got the ever popular trazodone. So this can be used from 50 milligrams to 150 milligrams at nighttime. This is often used for its sedative effects. It works by boosting serotonin and is good for promoting relaxation and sleep. However, in some people, especially at higher doses, you could get dizziness, dry mouth, and low blood pressure. So something to watch out for. And again, as with anything, start with the low dose. I sometimes even have people cut the 50 milligram in half and start at 25 milligrams. Then we have mirtazapine at 7.5 to 15 milligrams. This dose is effective for sleep. And this is another funny medication where the lower doses actually work for sleep and higher doses don't make you fall asleep at all. And yes, it is another antidepressant. So there's something about these neurologic drugs where different doses have different effects. The problem with mirtazapine is that it can lead to weight gain and increased appetite, but it is a good choice for many. I've had people who could not deal with any other medication, and then mirtazapine did the trick. Great tool to have in your back pocket. Amitriptyline is another antidepressant that's sedating, and we use it at 10 to 20 milligrams, but this too can also cause some side effects. So the side effects with amitriptyline are dry mouth, constipation, and similar. Then we've got quetiapine or Seroquel. I see this a lot, and I think it's because in the hospitals we use Seroquel for sleeping, but it really isn't a preferred medication to help people sleep long term because it's got some significant side effects. 25 milligrams to 100 milligrams is a typical dose, and it's actually an antipsychotic medication that also helps sedate people, so it helps them sleep. But it does come with some side effects like weight gain, and a lot of people do have daytime sedation. So these medications aren't usually first choices for sleep due to their side effects, but they are useful to have in your back pocket. Insomnia is terrible, so sometimes you've just got to go through the gamut and figure out what works for you. If you're talking to your doctor about what medication you want to try, you might want to think about it depending on your particular symptoms. If you're struggling to fall asleep, stay asleep, or maybe both. So DORAs are great, like I mentioned, if you're worried about dependence and need help with both falling asleep and staying asleep. Low-dose doxepin is a good choice for those of you who fall asleep fine but can't stay asleep. And Z drugs are helpful for short-term emergencies of sleep, but they do have a high risk of dependence. And Ramelteon is ideal if your sleep issues are more related to your circadian rhythm, like shift work or jet lag. Age matters too. So for older adults, controlled release melatonin and low-dose doxepin are often preferred because they come with fewer risks compared to the other options like the benzodiazepines or benzo-related pathway drugs. Those are habit-forming and they can lead to cognitive side effects and even dementia long-term. Another important consideration is rebound insomnia. This is when your sleep problems actually get worse after stopping certain medication, especially Z drugs. So this is why it's really important for you to be careful, start with the lower doses when possible, take drug holidays, and don't go straight to something like the Z drugs, even though they will knock you out. I forgot to mention this earlier. Z drugs actually aren't great for your sleep architecture. So even though you are unconscious, you're basically knocked out. Your sleep architecture isn't going through the restful sleep cycles that are helpful for long-term restoration. Finally, you might want to taper off rather than stopping medications abruptly if you've been on them for a long time to prevent that rebound. I'm also going to put in a quick note here because I didn't discuss it before, but a lot of people are using marijuana products to sleep. This definitely could help you sleep, but again, it has a lot of issues with it. It actually lowers your amount of REM sleep, so you end up not having very restful sleep, and also it can lead to dependence. So people, when they stop taking marijuana regularly, they have trouble sleeping later. It's not a preferred option, but in an emergency, I suppose it can be a good option if it's legal in your state. Remember, medications work best when we pair it with the behavioral strategies like CBTI and also with the lifestyle aspects like I mentioned with diet and exercise. Now, let's dive into some of the cutting edge therapies and experimental interventions for insomnia. These options go beyond standard medications and lifestyle changes, and some of them are even still in clinical trials. These offer promising new approaches for anyone who hasn't yet found lasting relief. And if you're that someone, you could actually seek out clinical trials to get on them and see if they solve your insomnia. Just to quickly mention, we talked about DORAs already, but there are actually more are in clinical trials right now. They have funny letters and names like DORA 22 and NK 4035, but there's more and more coming to market, which is a good thing because the more there are in terms of competition, the lower the prices will come down. And again, these work really well by blocking that stay awake signal in your brain. Next, we have transcranial magnetic stimulation, or TMS. Specifically for insomnia, insomnia, repetitive transcranial magnetic stimulation, or RTMS, has been studied. This is when we use magnets in a non-invasive technique to stimulate specific parts of your brain. So you gently influence how your brain cells communicate with this magnet outside of your head. Studies actually support stimulating the dorsolateral prefrontal cortex to improve sleep quality, and the effects can actually last for weeks after treatment. What's exciting is that RTMS could be personalized in the future, so different doses or targeting specific areas based on gender or sleep patterns. This personalization makes TMS an intriguing non-drug option for better sleep. Unfortunately, right now, as you could tell from my description, the effects do last several weeks, but it's only several weeks. So for a lot of people, this is not enough of a good option because you want to solve your sleep issues forever. Now let's talk about a relatively simple one that you could do already. So light therapy is really easy to do at home, and it's great for people who have circadian rhythm problems. Studies support using morning light exposure naturally or using those sun lamps that are safe for your eyes and exposure to your skin during the mornings. Getting 15 to 30 minutes again of the morning sunlight or of these sun lamps could be really helpful, especially if you have delayed sleep phase syndrome or if you have shift work. Now here's a really interesting one. Cryotherapy, or exposing yourself to very cold temperatures for a short time, isn't just a wellness or athlete therapy. So emerging research suggests that it can also help people who have trouble sleeping. Imagine stepping into a chamber set to sub-zero temperature for just a couple of minutes. This process helps reduce inflammation, pain, and overall stress, which are all known sleep disruptors. One study showed that cryotherapy improved slow wave sleep. That's the deepest and most restorative stage of sleep. It might be particularly helpful for people with pain-related sleep issues, but we need more research to nail down the ideal way to use it. We've talked a lot about temperature, but you might not know that there's actually temperature-controlled sleep systems out there. So these are systems that adjust the temperature of specific parts of your body, such as the cervical spine, so the spine in your neck, to help you fall asleep faster and stay asleep longer. A recent study showed that mild heating, actually, of the cervical spine increased blood flow, lowered our core body temperature, which is weird, I know, and actually improved sleep quality. So these systems allow you to cool or warm different parts of your body precisely, which can help align your body temperature with a natural sleep-wake cycle. Then we have auditory stimulation. This is when we use white noise or other relaxing sounds and techniques like alpha phase locked auditory stimulation to align sounds with your brain waves. This helps you drift into sleep more quickly and stay there. Devices like Dream, Smart Sleep, and Sleep Loop use these sounds to enhance deep restorative sleep. There's also evidence that ASMR, those soft, soothing sounds that some people find relaxing on YouTube, as well as white noise or pink noise or brown noise, can help calm the nervous system and promote better sleep. This is great if you're looking for something non-invasive, even free, to support your relaxation and sleep. Building on the idea of brain stimulation, there's other non-invasive options. We talked about the transcranial magnets, but there's also transcranial direct current stimulation and transcutaneous auricular vagus nerve stimulation, or TAVNS. These techniques use electricity, so actual electrical currents, to modulate your brain activity, improving sleep quality and efficiency. So by enhancing cortical slow oscillations, that's essentially the brain's slow waves during deep sleep, these methods can help you achieve more restorative rest. They've shown promise in studies with people who experience major depressive disorder or depression, which often comes with those sleep issues. Many of these cutting-edge therapies are still being tested in clinical trials, but if you're curious, you can check platforms like clinicaltrials.gov or talk to your doctor who might be able to get you access to research study. We covered a lot today, from why sleep is so crucial to advanced and experimental therapies for managing insomnia. But not all sleep problems are actually insomnia. Up next, let's talk about some of the common reasons for sleep disturbances that might look like insomnia but need a different approach.